Upstate Medical University in Syracuse, New York invites you to be the informed patient with the podcast that features experts from Central New York's only academic medical center. I'm your host, Amber Smith. Global health researchers have been studying how the changing climate is impacting health all over the world. One health field that is especially concerned is that of otolaryngology, the ear, nose, and throat doctors. Here to explain the concerns is Dr. Evan Hughes. He's a resident ear, nose, and throat doctor at Upstate. Welcome to the Informed Patient, Dr. Hughes.
Hi, well, thank you for having me. I'm excited to be here.
As an ear, nose, and throat doctor, you see patients with allergic rhinitis. Can you describe for us what that is?
Sure. So, allergic rhinitis, or hay fever, as people often call it, is basically your body's immune system overreacting to harmless things in the environment: pollen, dust mites, mold, pet dander. When you're exposed, your body launches this exaggerated response that causes inflammation in the nose and sinuses, and that's what leads to all those classic allergy symptoms.
Such as like runny nose, congestion.
Exactly. Congestion, sneezing, itchy eyes, even more vague things. It can affect people's sleep and energy levels. So, for a lot of people, it's more than just a nuisance.
I was going to ask that because it's the huge nuisance, or it can be, but for some people, it can be more than that.
So essentially, what allergic rhinitis does to the body, the main thing is rhinitis means inflammation. So, uh, when your immune system detects an allergen, it releases histamine and other chemicals that cause swelling, mucus production, and irritation. And that leads to those symptoms: congestion, sneezing, itchy eyes, and all the other symptoms people associate with allergies. It can also affect sleep and energy levels. So, for a lot of people, this affects their day to day lives.
So, who is most affected?
Allergic rhinitis can affect anyone, but it usually starts in childhood or young adulthood. Um, there's not a huge gender difference, I'd say, but we do see disparities when it comes to race, income, and environment. For example, people living in cities or in areas with more pollution tend to have worse symptoms. Outdoor workers like landscapers or farmers are also more exposed and often more affected.
And typically, how do people treat this on their own at home? What do they take to feel better?
Most people start with some over the counter regimen. So that includes oral antihistamines. Think your cetirizine or loratadine brand names that come to mind, Zyrtec or Claritin, and intranasal steroid sprays like fluticasone, also known as Flonase, or azolastine, Astelin, Astapro. People also use saline nasal rinses like neti pots or Neilmed, and these can be really helpful. And then the other main thing is trying to reduce exposure. So our academy recommends things like keeping windows closed during pollen season or using HEPA air purifiers at home. Washing your bedding frequently in hot water kills dust mites, and controlling humidity levels with dehumidifiers to prevent mold growth.
So, at what point would someone with allergic rhinitis end up in the office of an ear, nose, and throat doctor?
Usually, when those at home treatments just aren't cutting it. So, we see patients who are dealing with complications as well, like chronic sinus infections, nasal polyps, or issues sleeping and breathing. Sometimes it's not just allergies, but also there's an anatomic component, like a deviated septum, that makes things worse. That's where we as surgeons get involved with certain procedures such as sinus surgery, turbinate reduction, or septoplasty.
So, you may be able to fix sort of an underlying issue that would make them be able to cope better with allergy season.
Exactly. And to allow more effective delivery of some of those nasal sprays or medications that we offer. So, as an ENT, we can really take a closer look inside the nose at the sinuses using specialized cameras or nasal endoscopes to evaluate the inside of the nose and sinuses. We can adjust medical therapy, recommend allergy testing or immunotherapy, and in some cases, like I mentioned, perform surgery. And that might mean improving airflow through septoplasty or reducing inflamed tissue to help patients breathe better. It's all about tailoring care to what each person needs.
Now you said septum, and that's the middle of the nose, the the piece in between the nostrils. Is that right?
Yes, ma'am. Yeah, we have a cartilaginous septum up front and then a bony septum in the back. And it should be midline. Often it's not, and that's where we can intervene and straighten the septum, cut out deviated parts of that cartilage that are obstructing nasal airflow.
And you also use the term turbinate. What is that?
So those are knuckles of tissue, mucosa in the nose that help warm and humidify the air that we breathe. In some patients with allergic rhinitis, um, these tissues hypertrophy or grow and can obstruct nasal airflow as well. So we have ways of reducing those knuckles of tissue to improve airflow.
This is Upstate's The Informed Patient podcast. I'm your host, Amber Smith. I'm talking with Dr. Evan Hughes. He's a resident ear, nose, and throat doctor at Upstate, and we're talking about how our planet's warming climate is affecting allergy season. Now, you were involved in a study that was published in the journal Laryngoscope that looked at the impact of climate change on allergic rhinitis. How was this study conducted?
Yeah, well, I was part of a bigger team led by Dr. Nilima Tumala from George Washington University, but we did what's called a scoping review. So we cast a wide net and looked at all the high quality studies from the past couple decades that examined the relationship between climate change and allergic rhinitis. We searched across 5 major medical databases and looked for studies that measured things like temperature, pollen trends, CO2 levels, and how those factors relate to allergy prevalence and severity.
Is there a particular type of pollen that's causing the most problems?
Ragweed is a major culprit, I would say. It really thrives in high CO2 environments, warmer environments, produces massive amounts of allergenic pollen. Tree pollens like birch, oak, and cedar are also on the rise, especially in urban areas. So depending on the region and time of year, different allergens dominate, but ragweed is definitely one of the most problematic.
So, when is ragweed prevalent in birch and oak and cedar? What time of year do we see the pollen from those trees and grasses?
Yeah, great question. These different pollens do predominate at different times of the year. So typically in the spring, we think of our tree pollens like birch, oak, cedar. And then in the summer, the grasses start to predominate. And in the fall, things like ragweed seem to predominate. And ragweed is a major culprit. So it thrives in that high CO2, warmer environment, produces massive amounts of allergenic pollen.
Now, what was found regarding people seeking care for allergic rhinitis?
So several studies that we looked at showed an increase in healthcare usage, more doctor visits, more ER visits, more allergy medication being purchased, especially during peak pollen seasons. And it's not affecting everyone equally. People in low income communities are more exposed and often have less access to care, so they're getting hit hardest.
So, you saw this increase over a few decades of several years?
Yeah, our study looked at over 500 studies from 2000 to 2023 and ended up including 30 high quality papers that directly address the intersection of allergic rhinitis and climate related variables. Our goal was to see where the science is pointing, and it's pointing in a pretty clear direction. 16 of those 30 studies found that pollen seasons are getting longer, starting earlier in the year, and that pollen concentrations are going up. For example, one study we looked at showed that in North America, the season has lengthened by about 20 days, and total pollen emissions are projected to increase by 16 to 40% by the end of the century. which is a pretty dramatic shift, and it's something patients are already feeling.
And that's a result of the warmer climate.
Exactly. Warmer climate, higher humidity levels, increase in CO2 levels.
What request did healthcare professionals make?
So in the studies, we found one of the clearest takeaways was that providers want more education. In one of the studies we reviewed, 97% of healthcare professionals surveyed said that they were seeing earlier and longer allergy seasons, but many didn't feel equipped to explain the role of climate change to their patients. There's a real appetite for better tools and training on this.
Are you seeing more patients with severe symptoms in central New York?
Yeah, I'd say we are. I've been a resident up here now for 4 years, and upstate New York is like much of the Northeast. It's unique in that we have very distinct seasons in comparison to other parts of the world, which leads to a wide variety of plants and a vast variety of pollens. So I have noticed in our clinics patients saying they're getting their symptoms earlier in the year. It's now more of a year-round issue. Their symptoms are more intense than what they are used to, that sort of thing. It may not sound huge, but for people struggling with allergy symptoms, 3 more weeks of symptoms is a big deal.
So is there anything they can do, or are they just going to be left to take medicine for longer amounts of time?
Yeah, so step 1 is kind of knowing your triggers. And step 2 is starting treatment early. So ideally a few weeks before the allergy season begins. And that's a huge part of our research, and our ultimate recommendation was stay on top of local pollen forecasts, keep windows closed during peak pollen times, shower after being outdoors, consider using a HEPA air filter at home. And if symptoms are still interfering with your life, come talk to us, talk to a specialist. We have a lot of tools that can help.
So really, we're talking about all of spring, all of summer, all of fall. Are we talking about any parts of winter, the beginnings or the endings of winter?
Yeah, definitely. I mean, with increases in severe weather events and rainfall, we have more humidity that builds up and more mold in people's basements and their houses. And typically in the winter, that's when the mold starts to become the most prevalent allergen. And so people do deal with allergic rhinitis symptoms year round.
Well, healthcare professionals have expressed a desire to understand more about climate change's impact on health. What would you like your healthcare colleagues to know regarding allergic rhinitis?
I'd say ultimately, allergic rhinitis is one of the clearest examples of how environmental shifts are directly impacting patient care. So if we understand that connection, we can give better advice, help patients get ahead of their symptoms, start treatment earlier, get ahead of that inflammatory process that's going on in the nose, and maybe even push for changes beyond the clinic. So there's real power in sort of being aware and being proactive.
Well, this has been very helpful. I appreciate you making time to talk with us about allergic rhinitis, Dr. Hughes.
Anytime. Thank you for having me.
My guest has been Dr. Evan Hughes, a resident ear, nose, and throat doctor at Upstate. The Informed Patient is a podcast covering health, science, and medicine, brought to you by Upstate Medical University in Syracuse, New York, and produced by Jim Howe, with sound engineering by Bill Brokel and graphic design by Dan Cameron. Find our archive of previous episodes at upstate.edu/informed. If you enjoyed this episode, please invite a friend to listen. You can also rate and review the Informed Patient podcast on Spotify, Apple Podcasts, YouTube, or wherever you tune in. This is your host, Amber Smith, thanking you for listening.